Welcome to the Dr. Greg Show, October 28th, 2025. Thank you so much for being here. Thank you. What's up, TikTok? How are you? Welcome, YouTube. Thanks for being here. We appreciate you. There is a lot of work to do. We are currently organizing to try to stop the 423 bills that are pro-MAHA, anti-public safety bills that are destroying our public health. They're trying to ban cancer vaccines. They're trying to ban gene therapies. They're trying to attack our public health. Not just vaccine mandates like what was talked and approved in Idaho, by the way. Idaho passed what Florida was talking about, but that didn't get any news coverage for some reason, but it did. It happened, and we are trying to organize to stop that from happening. That's what we are doing. We are trying our best with what we can, and right now we are calling and emailing specific states that we feel like we can impact. So. All right, guys. It's so weird. Okay. All right. So if you go to action.drgregshow.com. All right, guys. We are going in. The next bill that we are going for is Michigan Bill 4778. That's who we're going for. Michigan 4778. Michigan. Here we go. All right. All right. So HB 4778 seeks to amend Michigan's public health code to prohibit any person or governmental entity from ordering or administering a gene-based vaccine. So that bill explicitly defines this to include the modern life-saving vaccine technologies such as messenger RNA, modified RNA, self-amplifying mRNA, and DNA technologies. So it's just wholesale cloth banning the latest and best molecular biology tools that we have. It doesn't make any sense to me. So that's what we're doing. So action.drgregshow.com. This is what we're doing. This is how we're organizing. Putting a new text on the screen, guys. Join. What should I do? Actions. Join us. Join us. Or what's like a one-word thing that's like an actor? That's like a good call to action word. Join us. Engage. Engage. Let's see. I got an error when I first did. Okay, let's just try that. Action. Engage. Okay, guys. This is it. Boom. All right, where should this go? Is this a good place? How is this? Is this a good place? Let's see. Is this right here? Hi, Duchess. How's it going? Is this a good place? You guys like this? Engage. That's it. Is that good? Is that good? You like that? Okay, cool. action.drgregshow.com, guys. And that's where the latest stuff is. So I'm reading about it right now. So the bill would make it illegal to administer many current and future vaccines, including COVID-19 vaccines. Furthermore, it adds language that would make a licensed health professional subject to disciplinary action, including loss of license for violating this prohibition. All right, guys. And then we are going to try to add these links in. This tell. All right, guys. And if you do an action, you do an email, you do a call, let me know, and I will add you to our actions tracker. So this is what we're doing. We are organizing in order to try to stop this Michigan bill. And if you do one of the actions, we will recognize you. We will celebrate you, and you will be added to our list. And we appreciate you. Also, anyone that's been vaccinated recently. Hi, Just Kristen. How's it going? We also track vaccines because we love people getting vaccinated here because vaccines are safe and effective, and they contribute to public health, and they're very important in our society. So that's what we're doing, guys. That's what we're doing. I got a couple of other shows, other ideas, other stuff, but action.drgregshow.com. That's going to get you to our action center. We organize on Discord. We organize here. We have a shared Google Doc that allows us to understand and to grow this movement that's been conceived, tracked completely. Guys, we are completely transparent. I'm in the hole on this. But it's okay. It doesn't matter. We believe strongly in this. And I think we can have genuinely have a huge impact at the state level on this stuff. I don't think that they have thought about it. Yeah, I'm in California. Yeah. Are you trying to dox me? Are you trying to... Oh, thank you, Irene. Thank you. There's lots of really good ones too. I mean, I'm not the only one. I think Dr. Keisha Davis is my favorite one. She's like a really, really awesome show. If you don't follow her already, you should. She's really good. All right, guys. Who is going to be our first one? Our first action, our first email. Ado, what's up, brother? Yeah. Oh, yeah. The flu vaccine is good. It's safe and effective. Of course. Of course. Of course. Of course. All right. Science. What's up, Ado? Dude, we are organizing for Michigan right now. We are organizing for Michigan to try to stop these MAHA bills. This one specifically in Michigan is banning now and future vaccines. So we are trying to stop this from happening. It is explicitly bans mRNA technology, DNA technology, that kind of stuff. Oh, did someone? Oh, no, I didn't. I'm sorry. If I haven't recognized you. I'm sorry, guys. I've been doing this thing. I got the flu vaccine. Lisa. Nice. Okay, Ice, 1 second, dude. Lisa, you're awesome. Thank you so much for getting vaccinated. Get your flu vaccine. 951, guys. Let's give it up for Lisa. Nice. All right. Give it up for Lisa in 3, 2, 1. Nice. Oh, Juliana? Juliana made some calls already? No way. Let's go. Annie. All right. Annie. Let's give it up for Annie, guys. She got her flu and COVID in 3, 2, 1. Nice. Ice Trail. Ice Trail got one too. Ice Trail, good job on your COVID vax plan. 3, 2, 1. Yes. Yes, they're for all vaccines. All vaccines are safe and effective. Yes. They're not. They're not, Charlie. They're trying to because they're against public health. So we're trying to stop them, and we will stop them. Pneumonia. Diane, you're amazing. Good job. All right. Who's Juliana's phone calls? I'm so sorry. Did I miss them? Where are you? Where is Juliana? I made 2 falls today. Though I said I was way too anxious to do it, but I did it. Juliana, Monica's version. Let's go, dude. Juliana, you're awesome. Breaking our actions today, our first actions of the day, guys. Juliana, Monica's version. Give it up. Juliana's, Monica's version. Thank you so much. You're awesome. You're a legend. In 3, 2, 1. Cool. Good job, guys. I mean, Ice Trail, the mRNA technology one has been linked to decrease cancer rates. So just letting you know, if you ever wanted to decrease your chance of getting cancer, it's a good place to get, good thing to get. Oh, nice, Annie. Well, I'm glad that you're vaxxed now. I'm glad that you're taking it up. Thank you, Allie. Thank you. We're not going to lose, Desner. We're not going to lose. Science will win. Definitely. Okay. I know, Donna. It is crazy. I know. That is frustrating. I don't, Starshine, I'm sorry. I don't know about dementia research. I'm sorry. All right. Sorry, guys. Just had to check, making sure our chat, we're up to date. I got my PhD from University of California, Riverside. So what's the Pfizer and Moderna vaccines that reduce cancer? Yeah, the mRNA ones. The mRNA COVID vaccines reduce cancer. It's crazy. There's been a new study out. I covered it 2 days ago. I should probably make a video of it, to be honest with you, because it was huge. It's a huge thing. Should cut my thing. 1 second. Let me make a note. This. Oh, cool. Cool. Ollie wants the house. So, guys, we have, if you're new and you're just coming in, which is awesome. Thank you for being here. Guys, we're targeting Michigan today. Michigan HB 4778, but we also did Massachusetts the day before, and then we did New Hampshire the day before that. So we are doing we're doing a lot of different states, and we have call templates, email templates for every single one, and you call or you email and you contact them any of the days, any of the bills. Let me know. We will count it. We specifically went with New Hampshire and Massachusetts because they have public comment coming up. So that is something that we have. Yeah, that's what it is. No, Jason, that's not. Yeah, that doesn't make any sense. Why are you counting vaccinated people? I'm not counting vaccinated people. We're counting vaccines. So if someone gets mRNA, COVID vaccine, and a flu vaccine, then we count it as two vaccines. Yeah. Or MMR, which is technically three, we count it as one. No, I just got out of the shower. Aloha. Diane, I think we should. I don't know where we can make the biggest impact in Florida yet. We need to check that. You know, I'm down. I'm not afraid. Hi, Rapture. What's up? I'm not afraid. Um, what do you guys think about this text? What do you think about the text here? Is this better? How about fight Maha or defeat Maha or engage for science? What do you guys think? Is that better? Mava? Mava. We will, guys. We will make Mava a thing, huh? It's going to be sick. Engage for science. Okay, with that. Boom. How do you guys like that? It's good, good, good. Crush Mava. Engage for science. Engage science. For. Have you heard about the job? No, Rapture. My resources have, my references have heard that they were contacted. So I think that like they were looking for it. Okay, cool, Crumble. That's nice. I mean, you see Riverside's like in the top 20 of public universities in the country, but you know, that's fine, dude. You can do whatever you want. You'll find like that it's not where you went, it's how you use it, man. So at the end of the day, like where you got your PhD from is a big deal, but at the same time, it's how you use it, what you use it for. So a lot of people that you're graduating or that your cohort like won't even graduate with you, man. Like so, yeah. Stop. Yeah, that's a good idea for like yeah, help children or children lives matter. Children's lives matter. That's a good idea. Sponge, I've thought about making a book, to be honest with you. I have. That might be a project that I work on in the next like year. Um, yeah, I might. I don't know what it would be about though. I haven't brainstormed about it. It'd probably be like something have to do with, you know, science for government, you know, using technology in order to like better government and that kind of stuff. So that's what I would think. Along those lines. Awesome, Ollie. Thank you. Appreciate you. How government killed our industry. Yeah, maybe. Maybe. Not if I have anything to say about it. We'll see. Can you guys see this? Can you guys see the URL? He got bananas. Oh no, again? Is this can you guys see this text right here? Does this make sense? Can you guys see the action.drgregshow.com? Is that good? Okay. It looks like it's just above the text for the chat. So I think it should be good. All right, cool. Thanks guys. Thank you. Thanks, Cam. Science and the legal system. Yeah, yeah. I mean, I do think, I mean, I do think in general. Hi, Madison. What about a business sign on letter? I don't understand what you mean by that. What do you mean by that? A business sign on letter. No, you're right, Bailey. So so my kiddos are doing little league for the first time, my oldest, and he is playing baseball for the first time, and he's on his little league team is called the Dodgers. So I was watching the Dodgers World Series game with him, and it kind of went really long. So yeah, it went super long, and I wanted to watch it with him, and it was kind of like a good bonding moment and stuff with him. So I didn't want to stop it just for the live, but it was fun. It was really fun to do that with him, you know, and have that moment. You know, it's like his first game that he ever watched, and I couldn't like end it early. You know what I mean? So yeah. So anyway. So we'll see how it goes. He's got to watch 2 games. Yeah. Yeah, for sure. We'll have to see how it goes. The World Series and everything is pretty cool for him, and he's super excited and watches all the games. All right. Okay. Yeah, exactly, K-Bug. It was really fun. Yeah. Oh no, lady. Nice. Go for it. Yeah, we were watching the game tonight. It was really fun. So it was fun. Yeah. Oh, private firms that are vaccine supportive. Oh, so put out like signs, put out signs of your business to say that they support the vaccine mandates and stuff. Hi Manny, how's it going? Yeah. Yeah.
Hey, sorry,
Hi.
it's medicine.
What's
Too
up?
much to write. No, it was a good idea. We had a discussion about that, but what, biotechnology firms,
Mm-hmm.
other, like we've got Epic in Madison, which is a huge, I mean, that is the economy
Mm.
here, that you have a business sign-on letter or have these businesses write to these politicians saying,
Oh, that's a good idea.
with a little more influence. I didn't know, I'm just thinking of science firms and things like that, or even health
To
firms.
science
I don't think it would
firms.
have to necessarily be that way. I mean, I think there's a lot of businesses that believe in epidemiology and keeping the public safe. And if it was a long sign-on letter and you had some industry behind, that was just my dad's idea, and I thought it was good, so I thought I would tell you about it.
Nice.
You do the work. I'm the ideas man.
Yeah, yeah. No, no. Well, that's like a good idea for ChatGPT to do. um, okay, yeah, let's do that. Let's do that. Let's do that right now. Let's make it, and then we'll email it to. Okay, cool. Let's try that right now. All right. Let's see.
Well, I can't help. We do
Okay.
sign-on letters all the time on like ESA or
Yeah.
supportive on policy, but saying hey,
Yeah.
you're
Okay.
endangering my business. I mean, I know it sounds horrible, but let's
No.
face it, that's all that matters to these people.
No,
is
for
money.
sure. That's a big thing. Okay, cool. Okay, cool. I'll do that right now. Thank you. That's a really good idea.
Yeah,
Thank
sure.
you.
I'll drop down. Sorry about that. I just
Okay.
was like, I'm
No.
tired of typing.
No. Yeah.
Okay,
No. I
sorry.
appreciate you. Thank you. That's a really good idea. All right. We'll do it right now. Thank you, Madison. Ew, awesome. Thank you for thinking about that. Okay. Here we go. Okay, Gemini. Write a letter to Michigan businesses that are focused on science, so health and biotech, those kinds of fields, and create a sign-on letter that the businesses could sign on to that would later be sent to the politicians of Michigan in order to tell them and urge them to vote no, because of their businesses being impacted in terms of public health, danger, safety, that kind of thing. Okay. Cool. Sweet. Go, Gemini, go. Nice. Nice, Manny. Oh, cool, Annie. That's awesome. Hi, Lauren. Hi, Nightflyer. Oh, thank you. Thank you, Rapture. Thank you guys so much. Estoy aquí. Hola. Here are two letters designed for your campaign. The first is a cover letter to industry leaders asking them to join, and the second is the sign-on letter itself intended for the legislator. Okay, that's a really good idea. Okay, do background research on science-related medical and biotechnology firms in Michigan that would sign on to this letter. What are your thoughts on using quantum entanglement for communication and space travel? That's out of my pay grade, brother. I don't have no idea. I can't even speak to my microbes. I have no idea. We know like C19. Yeah, exactly. C19 bad for business. C19 bad for business. Mitch Bio. My Device. Michigan Venture Capital Association. Pfizer. Pfizer itself is in Michigan. That's crazy. Stryker, Merck, AbbVie, Novartis. And then there's local ones too. So Ann Arbor Hub, Grand Rapids Hub, University Research and Commercialization Arms. Dude, this is a great idea. We should do this on all of the states. We should do this for all the states. HUS? I don't know what HUS is. I don't know what that means. Right. Cool. Nice, JR. That's cool, man. Okay, now give me email contacts for all of the above businesses. Wow. Health and pharma, 34% of Michigan GDP. Wow, that is gigantic. Can you recommend the best COVID vaccine option for this year? Yeah, LJ, I would get it, man. They need the Moderna or the Pfizer ones would be good. And the Moderna and the mRNA technology it uses actually gives you anti-cancer benefits. So it's pretty big, pretty cool. Okay, I'm sorry, Lorianne. I'm not a physician. I don't know. I don't know what that is. Okay, cool. Hey, Harry. Okay, cool. That's a cool idea. I mean, how would it work? How would they sign on to the letter? Okay. Yeah, get it if you could get a data table, that'd be good. That'd be sweet. Yeah, Harry, we did we looked into that and we actually looked into the one that China's building that is gigantic. Have you seen that one? It's like so big, man. They're actually shutting the one down in California on the way to Vegas for whatever reason. And China is just their one is gigantic. Oh, okay. Nice. All right, guys. So, real quick, we are organizing to defeat the Maha bills that are being built and targeted. Right now, we're targeting one in Michigan that is trying to ban future and current vaccine technologies, pertaining specifically to mRNA technology that just recently found to have anti-cancer properties, which is very cool. And we are trying to stop it. So trying to stop Michigan House Bill 4778. It would make it illegal to administer many current and future vaccines. Therefore, furthermore, it adds language that would make a licensed health professional subject to disciplinary action, including loss of license for violating this probation. So you could get your medical license removed if you gave a vaccine, which is absolutely unbelievable. They're building a gigantic renewable and sustainable energy production, molten salt. Harry, I think a lot of them don't believe that viruses are real. I think that's the big thing, is that they don't believe like in germ theory anymore. So they don't really care. They don't really think that viruses are a problem. If you don't think that viruses are real, how easy is it to discount and only think about side effects of vaccines, right? So unfortunately, that's just how it is. 30% of Republicans now do not believe in germ theory. They don't think that viruses cause disease. So Quang men, they do. I talked to a lot of them. They do. 30%. I have the graph right here, bro. Yeah, it's crazy. Here it is. Republicans, Democrats diverge whether or not vaccines are more dangerous than the diseases that they are designed to prevent. 31%. It's wild. It's crazy. Okay. Hisoka.
Yo, hello.
Hi, Hisoka. How's it going?
Good, how are you?
Good. What's on your mind?
Do you drink raw milk?
No. Why would I?
Dude, because it's like good for you.
No, definitely not.
Nah, I swear it is.
Okay.
What about like raw meat
Why would I do that?
or beef? Beef. Oh, I saw like the doctor thing, so I joined.
I'm a scientist, bro.
Oh, actually, I'm joining like randomized. My bad.
Yeah,
Dude,
no,
you should
I'm
get
an
on
actual
the you should
scientist.
get on the you should get on the raw diet.
No.
Yeah, dude, I swear, like, bro, that shit's good.
No.
When's the last time you had like raw milk?
Never. I mean, breastfeeding probably when I was a kid.
Yo, guys, drink raw milk, and eat raw beef.
Yeah, definitely don't. That is very dangerous. Can't have them doing that. Okay. Yeah, that's yeah. Yeah, fish, sushi, guys. Sushi. Yeah, that's how you do it. The sushi. You do it with the sushi. You don't do it with that. Okay. All right, guys, we are calling and emailing right now. action.drgregshow.com gets you to our action center, and that gets you the templates for emailing, the templates to make phone calls. And if you make a phone call, you make an email right now, I'll add you to the actions tracker, and we'll see it go up. It's a good, awesome thing, because we are organizing to take down. It's a takedown. Down. Yeah, definitely not JR, Bob. Definitely not. Yeah, coronavirus has existed before 2019, man. So that's we've known about them for decades. So that doesn't make any sense. I know. Isn't it crazy, Night Flyer? I know, it's so wild. It's so cool. It's so cool. No, it's not. It's not, Jer. It's not all about the money. There's science, and then there's a natural world that exists, man. There's DNA and sequencing that we have that shows that it was just a natural spillover event, just like every other virus, man. SARS-CoV-2 is no different. It's just that SARS-CoV-2 happened to spill over during a time that people are susceptible to misinformation, and you had a lot of people pushing disinformation through AI algorithms and conspiracies and disinformation agents like Russia specifically, that are like pushing ideas to harm people. Thanks, Natalie. You don't have to update it every time. Thank you, though. I appreciate you saying that. But thank you for liking. I appreciate you for doing that. Madison, I don't know. That's a good question. I hope so. I hope people get some. All right, guys. Well, thank you so much. I appreciate all the super fans. Thank you so much, Allison, for our last super fan. You're awesome. Thank you to the top gifters: Rapture, Helen, Noble, Sharon, Bailey, Ado, Nightflyer, Neek. Thank you so much. Thank you to all the likers. 100, 1,000, or 5,000, like Ado, or Diane, Bare Necessity, Legend, organizing their own phone bank, guys. They got all their friends together to do their own call last night. Just so awesome. Noble Sharon, Helen, 9876543235556, and Donna. Thank you, guys. Get involved. action.drgreg.show or action.drgregshow.com. Either one works. Getting involved, we can impact these. Oops, I hit the wrong button. All right. Okay, yeah, JR, that doesn't make any sense, bro. Chance, there are actual ideas on how to reverse lactose intolerance genetically, by the way. People are working on it, which is interesting. Okay, okay, Brenda, I don't think so. All parts of DNA. No, that's the thing, Jared. Like, you can't. Intuition is usually, you don't just have to go on intuition, man. You have to go on by what you can prove through science, because correlation does not mean causation, and that's the problem, brother. Like, you can have a lot of things that look like they correlate in that one caused the other, but in order to have that actual reproducibility, you have to mechanistically control for things, and that's what science is. So, all right. Businesses, a sign on letter to send to the state legislators. Okay. Hi, Dr. Mommy. How's it going? Gene therapy already is mainstream and affordable for cancer patients. So people have been doing it through mRNA technologies since 2015. So it is already a thing, and people are already doing it, or even gene editing humans in order to remove like some diseases when they're at the zygote stage. So people are already doing it. Yeah. Explain to us about humans can see the situation or manifest before exactly. I don't know what you're talking about, Natalie. I'm sorry. I don't know what you mean. Yeah, it's harder once the person is grown up, basically. Once that person's grown up with the disease, it's hard because there's two sets of DNA that you kind of have. One is like your testes and like your the genome that you have, that's like your core genome, versus like the ones that's in my like skin cells. So my skin cells will have different DNA, like a different genome actually, just slightly, based off of a lot of replications. And specifically with skin's an interesting one because skin will actually mutate because of the UV radiation from the sun. And that will mutate the DNA enough that like it doesn't even recognize itself, and then it expels those skin cells. So that's actually what a sunburn is. A sunburn is your epithelial cells being shed because their DNA has changed too much. And so it's hard to know and hard to target the exact cells that you want to change when it's like a disease. With cancer, it's like specific markers because I mean we can sequence it and we can find and create drugs that are specifically tailored to those mutations. But once it's like a child, I mean it's really hard to change all the DNA of all the cells, and that's a big thing. So yeah, I think that it's only going to be more affordable and more available as it goes forward. All right. Okay, guys. So also on the docket, I had a cool story. Yeah, sorry, I don't know about that one enough in order to speak on it. I'm sorry, I'm not a physician, so I don't know. I don't know about a lot about diseases and stuff. Hi, Jennifer. All right. Okay. This is a cool one. This is a cool show, the cool story, guys. All right. So, the story is plants have a secret language that scientists are only now starting to decipher. Okay, so signals from the plant cell wall help to orchestrate growth, reproduction, and immune function. Can harnessing this molecular crosstalk help in creating better crops? Ness, how's it going? All right. When Robert Hooke gazed through his microscope at a slice of cork and coined the term cell in 1665, he was really looking at just the wall of the dead cells. The squishy contents typically found within would become objects of ongoing study, but for the many plant scientists, the walls themselves faded into the background. They were concerned passive containers they were considered passive containers for the exciting biology inside. For a long time, the cell wall was really thought to be dead, said Alison Chung, a plant molecular biologist and biochemist at the University of Massachusetts, Amherst. It wasn't until the late 20th century, Chung said, that scientists began to reveal the cell wall for the vibrant, ever-changing structure it is. Even then, its complex mix of sugar molecules linked into long, branching polysaccharides kept away all of the most intrepid scientists. But now, with the help of modern molecular methods to analyze the wall's makeup and assembly, researchers are starting to uncover more. They're finding that the cell wall is an active, even chatty participant in cellular growth. Wow, that's interesting. Reproduction and responses to infection. It's constantly receiving and sending signals about its shape and composition. By eavesdropping on those signals and tweaking or adding to them, scientists are exploring innovative ways to improve agriculture with cell wall science, protecting crops from disease and engineering new plants or sturdy hybrids. The plant cell wall was one of the most sophisticated systems in terms of communication. Wow, that's really interesting, says Li Jiakuo, a plant biologist at Peking University in Beijing. His long-term goal is to use what's been learned about these messages to interbreed distantly related plants, creating exciting crops that could expand agriculture into new lands. Wow, really interesting. Yeah, Dr. Mommy. And also through their root microbiomes. They'll send nutrients down based off of how they're doing. They communicate like that, so they'll have like a whole community. Yeah, the whole forest will communicate to one another through the micronutrient signaling. It's so cool. I think that there's so much about plants that we don't understand. I think they're so cool. Thanks, Rose. These walls can talk. The wall is the plant's interface with its environment, including salt and other stressors or disease agents such as molds, so it must notice damage and adapt accordingly. The cell walls of growing plants are structured mainly from polysaccharides, including stiff cables of cellulose and jellified strands of pectin. The latter are highly complex molecules branched in diverse ways and decorated with various extras such as methyl groups. It's like a giant bowl of many types of pasta all mixed together, says Charles West Anderson, a plant cell biologist at Pennsylvania State University and State College. And although the wall protects the contents within, some pathogens use enzymes to drill through it and infect the cells. This creates polysaccharide fragments that signal to the cell that something has breached the wall. When the cell senses these pieces, along with fragments of the infecting pathogen cell wall, it activates genes in the plant's immune pathways. In response, the plant can produce an extra polysaccharide called callose, which reinforces the cell wall. Wow, interesting. It also manufactures defense molecules such as antimicrobial peptides and reactive oxygen species. Yeah, I studied reactive oxygen species in my PhD. It's very interesting. Yeah, plants are so cool. Exactly, Manny. They can talk. Exactly. Such signals are already being co-opted by farmers. By spraying molecules derived from the plant cell walls of algae or fungi over the fields, they can prime the plants for pathogens that might arrive later. By doing this, they wow, so it's like an adjuvant. They're like, no, they're yeah, like in immunology, that's what we do. We add the little things inside of that would be associated with a bacteria molecule. That's one of the ways that our immune system is primed in the presence of these molecules. And they're doing that with the plants of cell walls of algae and fungi. That's really interesting. Man, we are just sacks of cells, guys. That's pretty crazy. By doing this, they activate the immune response and let the natural mechanism of the plant fight the infection, says Antonio Molina, a plant biologist at the Technical University of Madrid. The method could help growers to avoid harsh fungicides, he says. Molina has co-founded 2 companies that make use of this technique, making extracts from fungi or plants as crop protectives. Wow. Yeah, mycology is really cool. The current inoculants are fairly crude mixtures derived from plants or pathogens, says Cyril Zipfel, a plant immunologist at the University of Zurich, Switzerland. He's working to understand the signaling that underlies the immune pathway, which should enable scientists to create more specific or even synthetic treatments. There are trade-offs, however, Molina says. For one, the effects last only 3 or 4 weeks. Reapplication for slow-growing crops could get costly. But Molina thinks that farmers might be able to focus the use of inoculants to times when risk of infection is high, such as after a rain, to prevent mildew. Ah, that's a good idea. Another challenge is that whenever plants devote resources to boosting their defenses, this makes materials and energy go away from growth, so farmers must apply the treatments judiciously. That's really cool. Okay. Plant growth itself demonstrates how the idea of a cell wall as a static shell is insufficient. Yes, the cell does need the wall as a physical barrier, otherwise it would burst from the enormous water pressure inside of it. But for plant cells to grow, the cell walls must expand first, said Sebastian Wolf, a plant molecular biologist at the University of Tübingen. Do I know this guy? I might know him. That's wild. There was a guy that was named this, and like that I worked with. He stayed with us for he stayed with us for the summer as like an exchange PhD student. He was so nice, but he was working with plants in our nanotechnology lab. Oh, no, it's not. That's so cool, man. That is so cool. What a small world, but it's not. Anyway, this is where pectin comes in. Pectin is a complicated molecule constructed from at least a dozen sugars connected by more than 20 types of linkage, says Wolf. It actually is so complex that we don't know what it looks like, he adds. Pectin is also dynamic, undergoing frequent modifications. Depending on these modifications, it can be rigid, supporting a sturdy plant, or softer when the plant needs to grow. That's why pectin is often used to make marmalade. The initially soft pectin molecules cross-link and soak up water, taking on a stiffer, gelatinous consistency. In the growing plant, there are one key modification that makes pectin soft or rigid: methyl groups attached to its component sugars. When the wall needs more materials for growth or reinforcement, the cells inside manufactures a methyl decorated form that is thought to be fairly soluble, so it can be secreted into the surrounding wall. Once the pectin is incorporated into the wall, it starts to firm up. This happens when enzymes remove the methyls, uncovering negatively charged atoms in the sugar molecules underneath. Calcium ions in the wall bind to 2 sugars at a time and cross-link the pectin into a stiffer material that can absorb water. Wow, so it like secretes these things into the base so that it kind of firms up the part of the cell wall on command. That's really cool. As a graduate student at the University of Heidelberg, Germany in the early 2000s, Wolf was interested in the effects of methyl groups on pectin, so he made a mutant of the cress Arabidopsis thaliana, a favorite plant of geneticists that would be unable to take off the methyl groups. So then the hypothesis would be that it would be a really stiff plant, right? He expected this to soften the cell walls, but the plants came out weirder than anticipated with long wavy roots. Because it made them very soluble. I'm sorry, I got mixed up. They reminded him of mutants with defects in cellular signaling involving cellulose, leading him to wonder whether pectin too had a role not just in cell wall structure, but also in cellular conversations. Continuing this research at the French National Research Institute for Agriculture, Food, and Environmental in Versailles, Wolf discovered a cell wall signal that contributes to plant growth controls. The input that Wolf found starts when cell surface receptors notice an overabundance of methyl decorated pectin. What seems to happen in response is that they tell the cell to adjust its production pipelines, making more of the methyl removing enzyme so that the wall can firm up with the pectin. Cell wall signaling can even help growing cells to adopt fancy forms, including the puzzle piece shapes seen in what are known as pavement cells, interlocking surface cells that give strength and structure to plant leaves. When Anderson and his colleagues studied the signals sent to the cell, as well as the pavement cells developed in Arabidopsis, they found evidence for other conversation initiated by methyl-free pectin in a receptor called pheronia that senses this form of pectin. But the cellulose matters here too. Both cell wall components are needed to strengthen the indented portions of the puzzle piece, known as necks. Without that fortification, the rest of the cell bulges into space. If pheronia isn't present, the indentations don't go as deep as they normally would. Wow, so just lots of signaling, lots of constant feedback then. That makes sense that because they're constantly expanding and they're having to know the current state of the cell. That is really cool. What? Stop playing with our food. What are you talking about? Yeah, nanotechnology is amazing. Really cool. You're literally using like a device that has nanotechnology right now built into it. Like, so like, what are you talking about? It's so funny. People are so anti, like so skeptical. So not skeptical, contrarian. Contrarian's a better word. Okay. Really interesting, guys. Well, there's more on the news feature on Nature, nature.com. Plants have a secret language that scientists are only now starting to decipher. Really cool. All right. All right, guys. We are currently organizing to try to defeat the 423 bills that are in the United States state houses right now. This is all the states. If your state is yellow, there are anti-science bills being proposed right now in your state. So we are trying to stop them. There's 423 of them. We are trying to stop them. We are currently calling Michigan because they are trying to ban present and future vaccines and make it so that medical providers would actually lose their license for administering life-saving vaccines. You're awesome, Helen. Oh my gosh, you are incredible. Helen, let's give it up to Helen, guys. She is so good. Ellen, bringing our actions to 121. Incredible. Let's give it up for Helen, guys. In 3, 2, 1. Helen, thank you so much. You are awesome. Helen is so cool, guys. She's constantly one of the first people in chat every single night. Always doing the actions. So cool. I appreciate you so much, Helen. I know, Ness. They are overplaying their hand so bad. They're overplaying it so insane. Well, Glacier, that's great. So you can still help and call and email, even if you live in a gray state. It's okay. I don't think so, Mr. Nine. That's not correct at all. Yeah, that's nonsense. Yes, Night Flyer. There's a lot of stuff in Texas. They have really, um, yeah, they're trying to pass a lot of stuff in Texas. It is very scary, but you got it. We have to fight, guys. It's going to be a lot easier now, to stop these from going through, than in the future once they passed. Do we email? Yeah, Glacier. You can email if you go to action.drgregshow.com. You have all the swing voter state legislators, their emails, their phone numbers. We have a email and phone template for you if you want. Yeah, it's all there. Can I ask what is in the vaccine liquid? Yeah, so New Dawn, it's very, there's lots of stuff in vaccines, and there's going to be really long, scary words, but they're all tested and they're rigorously tested, and vaccines are safe and effective, and the ingredients are all looked at, and it's okay. So you're not going to understand what all the ingredients are, and you're not going to understand why they're in there, but know that they've been tested and that it's safe. So that's the biggest thing. There's a lot of fear mongering around just like a big, long, scary words, but in the end, it's safe. They're safe. Yeah, I mean, well, okay. I mean, if you want to talk about it, this is the actual one, Pajama Z66 looked at. This is a 25-year study, 1.2 million kids that looked at the different ingredients in vaccines, and no neurodivergence was found with it at all. So, oh yeah, but also like they're testing out all the other ingredients that are in the vaccines as well, right? So no neurodivergence was found from it, and that's why vaccines are safe and effective, because they've gone through rigorous testing, and that's what it is. Yeah. Yeah, definitely not, Mr. Nine. Definitely not. Yeah, exactly, Dr. Mommy. That's just the latest one out of Denmark. That is the big one, the big cohort that's like been studied over 25 years. And that's completely different. And, I know a lot of the anti-vaccine people think, oh, it's like funded from, pharma. And of course they're going to say that, all that kind of nonsense. But in reality, I mean, these are studies that are outside of the FDA, that are outside the pharmaceutical companies. These are studies that are being done by third-party independent countries that have their own due diligence to do in order to verify the claims that they're hearing and they're seeing from other, from the United States. So they do their own, yeah, exactly, their randomized control studies, and they're all tested. They're tested to see to verify the claims. Yeah, so Pajama, there's a lot of like correlation does not mean causation. So there's a lot of things that could be correlated with one another, and there's a lot of things that are happening during those times of a kiddo's life. And just because something happens, like people think about hello from Sweden. So like, could reiterate, where's the link for the yellow states contact info? If you go to action.drgregshow.com, it's all in there. That's the URL that will take you to a Google Doc, and then that will have all the info in there. So Pajama, so for example, like people think about vaccines or something, but they don't think about, I mean, what did that child that day have to eat? Like what did they do that week? but for some reason they link it to the vaccine specifically. And it's just people are cherry picking data, and it can be deceiving. Stats can be very deceiving. Who's to say that the MMR didn't cause it? Science. Yeah, so science can help that. If there are, if there are super rare adverse side effects that do happen, but they're super, super, super rare, it does happen, but it happens at such a small percentage that the risk of getting something like measles far, 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 far outweighs the potential side effects of the measles vaccine. They do have informed consent, Apple. They do. Well, Joey, are you saying that prove to me that food didn't cause them to go nonverbal? And that's what my point is that you can't prove that. You know what I mean? You couldn't prove that. What? I don't understand what you're talking about, Pajama. Exactly, Dr. Mommy. Just because I ate cereal and developed a cough doesn't mean the cereal caused the cough. Exactly. And this is one that I like to have. Here we go. So this is autism diagnoses and organic food sales. So show me. So Joey Hongrunghausen, why is organic food sales causing autism diagnoses to go up? So why is the increase of organic food sales going up with autism diagnoses? You think are people with autism buying organic food sales more often? What is that? What do you think? You could do this too. Autism diagnoses correlate with Google Chrome usages. But I mean, you're not going through. Your text isn't coming through, Joey. I can't see you. You can't see what it. Yeah. Okay. All right. I'll make it smaller. There it is. There you go, bud. On the left-hand side is the sales in millions of organic food sales, and on the right is individuals diagnosed with autism. And on the bottom is the year. So why are organic food sales causing the rise in autism diagnoses? No, they don't, Apple users. You're exactly wrong, actually. They actually help the body fight cancer. So they're actually, like, the mRNA shots actually are anti-cancer. So yeah, the actual spike protein factories are SARS-CoV-2. So those are the hi, Kathleen. Spike protein factories are SARS-CoV-2, which is the virus. So viruses actually do it. No, there's no turbo cancer. That doesn't exist. That's completely wrong. There is no such thing as turbo cancer. It's an invented term that anti-vaxxers have coined in order to try to make it be strong. Okay, Apple, you're open to join, but I'm just gonna mute you so that you're this isn't about you, bro. So if you want to come in to the chat and you want to talk, but I can't have you just spread misinformation in the chat because it impacts me. It'll get me taken off. So, but you can come on and you can voice chat, but I'm not going to argue with you over chat. How many semesters do... Hi, Ashley. How many semesters do doctors study and test additives in med school on a scientific level? I mean, what do you mean? I mean, that wouldn't be how we are. That's not the gold standard of scientific rigor. How often they're studying it. They're studied, with meta-analyses and systematic reviews and that kind of stuff. I mean, the reviews, the science is done, and then meta-analyses and systematic reviews link those things together and get a better, broader source of knowledge. I don't know, Pajama. I'm not an MD. I don't know. I'm not a physician. I never went to med school. So, but it doesn't matter how long they studied it in school as much as it's like how studied is it in general. And people study it all the time. There's tons of studies on it. Scientific studies on it. Yeah. All right, guys. I am both. I am a doctor. I got a PhD. Yeah. Why has the government paid out over $8 billion in vaccine injuries? Interesting, Joey. I thought that most anti-vaxxers say that you can't even sue anti-vaxxer. Well, it's because there are really rare vaccine side effects, and there's a lot of people in those vaccine courts. Over 60% of them are settled, not because of science, but because it's just easier and a lot quicker to settle out of science, out of court rather than going to court. So you can sue pharmaceutical companies for vaccine injuries, but it's much easier to go to that vaccine court that was created in 1987 to get that restitution. And what the problem is that since anti-vaxxers haven't been able to show anything scientifically, they think that for some reason that going to these courts is actually a way to justify their anti-vaccine takes. And so they are using the legal system as restitution for bad science that they can't get published anywhere and they can't prove. So they're trying to prove it through the courts. And it's literally the nonsense that RFK does. I mean, that is like literally what he does. That's where how he makes millions of dollars a year, is doing those vaccine injury referrals. And then every time that they get a payout, he gets paid. So that is the actual corruption that you guys should actually care about, but you don't, because this isn't about corruption or anything to you guys. It's just, it's a nonsense. Yeah, I know what you're talking about. It's literally the 1986 thing that was passed, and yeah, he's been doing that, making millions of dollars a year on referrals for those cases. So it's, that's what he's been doing. What if they do it because they know it isn't provable? Pajama, they have proven it through science. Pharma does prove it through science every single time. Do you understand what like the trials are, the medical trials are. Do you understand what that is? Like the different FDA approval processes, they do prove it. And like I said, other countries prove it as well. So it's just wrong. You're just wrong to say that it's not provable. You might be willfully ignorant, you might not know what they are, which is fine, but it does exist and they're out there. No, no, pajama. Again, so you're doing this thing. So autism diagnoses are increasing with organic food sales. So what? So you're telling me that organic food sales doesn't cause autism? It looks like they correlate really well. So, but the real reason, this is called correlation does not mean causation. So correlation of two events doesn't mean that there are a causative link. So every time that there's a fire, there's firemen there. But does that mean that firemen are causing the fires? No. So what's happening, and Dr. Mommy's right, more screening is happening. And additionally, there's been, thank you, Kathleen. There's been more, an umbrella term of, that's what, more, Asperger's has now been re-diagnosed as autism level 1. So the spectrum of autism has increased now. So that is also like one of the things. Yeah, you just don't understand that, Joey. That's you're factually wrong. He makes millions of dollars every year from it. Yeah. He gets money for the referrals to these vaccine injury lawyers, and then he gets another kickback when they actually get their payout. So he's he gets millions of dollars a year, and he had to disclose that based off of when he became HHS secretary. He had no, Joey. He literally had to disclose that. He literally had to disclose that for his HHS secretary. We can look it up right now. We'll look it up live. He had to disclose it, his financials, and the people all know about it. It's not a secret. You just don't know that it happens. Okay. RFK vaccine injury lawyer compensation. There's been tons of double-blind placebo-based studies. Yeah. That's another like just anti-vax like talking point that doesn't make any sense. Like they have. I bet since there are so many more diagnosed, you'd have to have more awareness. Well, pajama, yeah, and you'd also have people that they have them. They have them. Let's see. RFK, HHS, salary, disclosure. Let's see. Kennedy and Madonna LLP. Let's see who they are. What are they? That's the law firm that he's making millions from. Let's see. What? RFK Jr. he reported $1.2 million in credit card debt. What? That's a little weird. He founded in 2007. He walked away with $326,000, doubling his pay rate. And that's linked with the groups that he would basically be the middleman between him and a lawyer. Aloha. He's one of us. What are you talking about, Joey? Oh, the credit card debt? You have $1.2 million in credit card debt? Oh, what's up, Mrs. Dr. G? How are you? I know, Katie. I'm sure he's getting a lot of it paid for by somehow. I'd love to see the actual disclosure, his financial disclosures. Oh, you can't see him anymore.
The Chevy Equinox is more than an SUV.
Yeah, he gets receives legal fees from a law firm continuing to sue Merck, the pharmaceutical company. The prominent anti-vaccine proponent was co-counsel with the law firm Wisner Baum in suing Merck over allegations that caused vaccine injuries to young men and women. And in his letter to Hall, Kennedy said he was, quote, entitled to receive 10% of the fees awarded in contingency fees referred to the Wisner Baum. So that's literally what it is. Among the cases for which Kennedy received fees are those involving claims against the U.S. under the National Vaccine Injury Compensation Program, which is exactly what I was talking about in 1987, that you again said that wasn't true. So wild. So crazy. Everything that you said that wasn't true was true. And everything that I said was true wound up being correct. Crazy. Yeah, Katie, exactly. I know, Ness. Isn't that crazy? Isn't that weird? Isn't that weird how that happens? I get lucky. I just get lucky. I spitball. Isn't that what you guys do? You just make it up on the spot, and then you just try to frantically find Google what you've tried to thought you said. Is that right? Is anyone? And then what's crazy is this guy is getting paid out millions of dollars a year from this, right? RFK is getting paid out by these pharmaceutical companies by suing them. And then he goes on and says to people like Joey or whoever his name is, you can't sue these guys. These guys are immune. Nobody can sue these guys. And then they believe them. And then what happens is like, that's the tale that they need to say, right? The dragon is so large and impervious, but I know a guy that can do it. You know, it's like, we can take him down. And it's like, what? It's just lying, man. People just lying to one another. It's so sad. I do feel, I feel bad for people that get misinformed. That's why I try to lead with compassion, but man, it's wild. Yeah, pajama. It's just exactly. He just had it floating. He probably paid for his campaign with it, right? He was probably just putting it on there. And it's an American Express. There's no limits to American Express platinum cards, so you could do whatever. Oh, did I miss something? Thank you, Dr. Mommy. I didn't see what you were responding to, but thank you for engaging. You can't see the vaccine manufacturer. Yes, you can. Yes, you can. Yes, you can. You're wrong, Joey. Again, you can sue the vaccine manufacturers directly. Absolutely, you can. For anything with malice. So, that you can actually, you absolutely can. But what you can't do is that you can't drag them into court for just random things. Just like this shows that these guys would never make vaccines, right? If they were constantly dragged into court for every single thing, every single civic matter, every single civil, that just doesn't make any sense. So yeah, governments have decided that vaccines are safe and effective, and they're important to have in our economy so that we can have public health and we can have Coachella with 100,000 people and we can have concerts with all these things. Joey, I told you what it was. You don't have to tell me what it is. I told you what the thing is. You don't have to tell me. I told you, dude. Yeah, Pajama, that's just wrong. I mean, I don't understand what you're saying. Pfizer is the company that makes these things, and they're honestly not that big of a company, guys. I don't know how to tell you, but yes, you can, Joey. Yes, you can. Like, I'm gonna mute you if you just keep repeating the same things over and over again. You can join voice, but like just flooding the flooding chat with non-serious engagement. It's not worth my time. No, Joey, you can't. You can for malpractice, like actual things that are like, yeah, you can do it, but you just can't take them into civil court. That's all the time, and drag them into court for everything. Meg, you're awesome. Good job, Meg. 9:56 and 3, 2, 1. Yes, you can, Joey, if it had anything to do with any type of malice. Yes, any action that was negligent. Yes, you can. But literally, the vaccine injury fund is so that it's quicker and easier to have a payout. That's the whole idea, so that you don't have to go to court in order to do that. The whole point is to give people an easy way in order to get money and restitution for really rare events that shouldn't have happened, but you have a quick way to get a payout if you want. And that's why 60% of them are payouts that don't actually go to court, and they just pay out of the fund. 75 cents of every vaccine goes into that fund. So that's where the fund, that's where it's managed from. That's where the money comes from. It's not the government. It's from all the vaccines that are administered. 75 cents is given to that. I know, Katie. I hate people in chat that stay in chat that aren't man enough to like come in to voice it, because it's just the conversation isn't as good. It never is like productive. It's really frustrating for me. But we do what we can here. Yeah, exactly, Kwongman. Yeah, you can't just if the vaccine manufacturers were just constantly having to pay out bills like for civil court for vaccine stuff, they would not do it, because vaccines, guys, the truth, the vaccines aren't that profitable. They're not. Thank you, Amanda. Vaccines aren't profitable, guys. They're not. They're just not. The margin isn't very high on them. They're not able to, like, they're not making a ton of profit on it, especially when governments buy them in bulk and cheap. Like the COVID vaccines were bought under the Biden administration at really low rates, making them really cheap. That's just what it is. That's just what it is. It's not a super profitable adventure for them. Yeah. Just from the kickbacks on this Wisner bomb Merck thing, he got $1 million, $856,000. So just $1 million a year just getting paid off because he was the broker and just trying to, like, the middleman and trying to get these people. It's insane. I mean, where is he getting $12 million in income? Vaccines undergo more rigorous trials than medications because we're giving them to healthy people. Oh, that's a really good point, Dr. Mommy. I agree. Yeah, that's a really good point. I mean, they have, and you know what's so funny is, like, if we created through a publicly owned biotechnology company that created these things and manufactured them patent free, no profit, just nationalized vaccine production, do we really think that all these anti-vaccine people are going to be like, oh, now that the pharmaceutical companies are involved, I'm going to get vaccines? Like, dude, come on, man. Nobody believes that. Nobody. So then the whole idea that the pharmaceutical companies are the hinge of this entire thing is nonsense. It's nonsense. And I ask people that all the time. Are vaccines good? Because I just joined, they ship a lot of them tonight. Yeah, they're very good. Vaccines are very good. They're safe and effective, and they really highlight the ability for science to make a positive influence in your life. Dr. Mommy, a lot of them don't even believe in germ theory now. That's the problem, is that anti-vaxxers don't believe that viruses cause disease. They literally believe in terrain theory now. They don't believe that people are getting sick because of viruses. I know, it's wild. I know. This is Republicans and Democrats diverge on whether vaccines are more dangerous than the diseases they're designed to prevent. Do you think that vaccines are more dangerous than the diseases they're... Because in their mind, if you just get rid of viruses, then the only thing that is right? The bad thing that can happen is the vaccine side effect, right? How convenient, right? And they think that SARS-CoV-2 was made in a lab, so they think that all these viruses or all these things are all fake, and they think that basically you get sick because of terrain theory. Is that basically that you're diseased and your body doing poorly is a function of your environment, not because of any type of infection of a virus or a pathogen. So people that died, that this is their claim, false claim that is completely unsubstantiated. They think that the 1.2 million people that died from COVID just weren't eating right. They were eating too many processed foods. They think that wrongly. They think that microplastics cause them to die early. That kind of nonsense. So it's very, very disconcerting. Someone recommended childrenhealthdefense.org. Have you heard of it? Thoughts? I mean, considering that was just something that was just flagged when we did the RFK background check, and Children Health Defense was on there, and he was the head of that chair. of that nonprofit org, I would say that it's probably a really bad site. I don't even want to go to it. I am pre-vaccines and I get them except polio, which is a disease that my aunt just passed from. I am Katie, you're pro-vaccines and I got them all except polio. Okay. No, you don't. No, you don't, Christy. No, you don't. I mean, Christy, you realize that thimerosal was removed from vaccines in the late 90s, right? You realize that, right? Not because it was bad, but because there was such an outroar of public demand for it that they removed thimerosal from vaccines. So we are in right now the post-thimerosal time, right? Like, and to that point, guess what? When thimerosal was removed, do we have any more autism diagnoses, right? If thimerosal was causing autism, then when we removed thimerosal and autism went up, how does that make any sense? Like, it's just, it really isn't hard to think about this stuff, guys. You just have to get actual data, and misinformation is so permeating on these apps and all this nonsense. It's so hard it really isn't hard, guys, but someone just doesn't have to lie to you, and someone, that's what I'm trying to do. I'm just trying to give you the reality and the truth. Yeah, I don't understand, Paja, what you're reacting to. Oh, I'm pre-vaccine. I didn't get the vaccines. Oh, that's why you got the polio. Oh, okay. Oh, okay, Katie. Yeah, you should get vaccinated then. How do people get so worked up about vaccines? Such a simple public health measure. Yes, Dr. Mommy. So, science is political. Like, the idea that we fund science through public funds is political. We have to fight for science in our politics. Okay? The problem is not that science got political. That's what people say, but they're wrong. It's that science became ideological. And that is the key crux of it, is that when you had science as a way to understand the world and tell us what to do during a pandemic, you had an authoritarian demagogue that didn't like that. Trump doesn't like the fact that you can understand the world without him telling you what the world is. So that's why he had to impugn science as an institution. And even though he himself loves science, right? He gets vaccinated. He gets vaccinated. He gets all the vaccines. Here's Trump's thing right here. He got vaccinated, including the annual influenza and updated booster vaccinations. So again, he gets them. Yeah, Dr. Mommy. I guess I'm honestly, like, political versus ideological is kind of like pedantic, so I can understand what you're saying too. It's just, but I'm an academic. I guess I'm just kind of like weird with that stuff. My point is that what's happened in the last 5 years is AI pushing conspiracies to people, because conspiracies are easier to understand the world. It's easier to understand the world when you are fed a little brain worm that, oh, I don't have to worry about COVID-19 because, it was made in a lab, which isn't correct, by the way. And there's been not a single piece of evidence to show that lab leak is real, by the way. Everything points through, genetic sequencing, population genetics, bat coronavirus cave sequencing, molecular biology, RNA sequencing, all that kind of stuff. But do you read and learn about that? Or Do you just think, oh, isn't it convenient that there was a Institute of Virology in the same spot that it outbroke? Isn't it convenient? Boom. And then you're hooked. And that's the problem, is that conspiracies are an easy way to understand a complex topic. And once you've been infected with a conspiratorial thinking, it's a lot easier to start knocking down other pillars of your intelligent fortress, right? There's a reason why anti-vaxxers that come in here, there's the reason why the lists exist. That's what the meme is, right? We have the lists that we talk about people with. This is the list of conspiracies that people anti-vaxxers will agree to about 90% of these. They just will. I didn't think that. I'm shocked at how often this happens, but they do agree with this stuff. It's crazy. They don't think that germ theory is real. They don't think that viruses cause disease. A lot of them don't believe that immune systems are real. They don't think that the immune system is a real thing. Obviously, they think that it leaked from the lab. They don't believe in the moon landing. They think that space is a projection because the Earth is flat and it's a 6,000-year-old Earth. And therefore, gravity doesn't exist and evolution isn't real. Dinosaurs were faked. Climate change isn't being caused by humans. Vaccines are obviously not safe and effective. So it's like, these are scientific consensus questions that we have all understood the world by. We have used science as a methodological way of understanding and answering questions to better understand the world. And scientific consensus questions are when you have multiple fields of science all coming together and pointing to something, which so rarely happens. But it does happen rarely, and those are important. Scientific consensus is a big thing. Yeah, Pajama, we get to have more vaccines. Vaccines are a good thing. Like we get to have vaccines. Vaccines are about 30 different diseases are stymied by vaccines. So if we didn't have those vaccines, they would be rampant in our populations and they would be outbreaking constantly. So it is a good thing that we have vaccines for so many different things. Oh, thank you, Juliana. Thank you for saying that. I'm not confused, Captain Rock. Definitely not. Thank you, bud. But you can request up and tell me how I'm confused if you want. I don't know who that is. I don't know who Sasha Latupovia is. I don't know. Because Pajama, they've found out. Oh, thank you, Dr. Mama. Thank you for coming in. I appreciate you. Always love when physicians come in here, and it's a cool community. I love it. Thank you so much. Because Pajama, they're basically live attenuated vaccines so that we can give them at the same time, and it's so that babies and what they're going through, like shots already aren't that enjoyable. So what we're giving compared to vaccines 20, 30 years ago, we're giving less amounts of them, and we're giving them less amounts of the antigens, and we're giving them shots together because they give sterilizing immunity, and we can give them all at the same time with no adverse side effects. So so the fever, so the fever that is being caused by them, you're not getting sick. The immune response is a good thing that's happening. The fever comes from your own body's response to the antigen, which is the little piece of the virus. and your body's training that. It's like working out on that training dummy, right? Your body is getting ready for that big fight, and you're training on that training dummy. So the fact that you're sweating and you're training isn't a problem, right? Your body is revving up and testing itself out, but it's not sick. You're not sick with anything, but it feels like you have an infection because your body is training like that. But it's a passing time, and your body would actually have way more of a response if you were actually sick with the virus. Bare necessity, you are so awesome. I love you so much. You are absolutely. I want to try to track like how much people are doing like per person, and you're one of the reasons why, because you are so cool. You're organizing your own call and email banks. I am so happy that you are here, Bare Necessity, in our community. You are an absolute pillar. Thank you so much. I really, really appreciate you. You are so awesome. And 3, 2, 1. Yes, Bare Necessity. One of the pillars of our community. Absolutely incredible. Yeah. Yeah, Alaya. It's been crazy. It's been so cool. I think it's absolutely amazing. That's amazing. That is so cool. That is so cool, guys. Can you explain SV40 for us? It's the promoter that was used, Christy. I don't think that it's like it's really just like some lingo that people are fear mongering about. It's nothing specifically, just a promoter that's used in molecular biology in order to make the protein of interest. So is this about the COVID vaccine or vaccines? They're all vaccines, Angel. Yeah. This one, the vaccine tracker here is for all vaccines. The Michigan bill that we were trying to rally against and we are doing political action for, that is for all mRNA based vaccines. So they're trying to ban that. If COVID's gone, do we still need the vaccine? Yes. So Angel, there's actually awesome anti-cancer properties of the mRNA vaccines that just came out this week. A new paper that just came out that said that because the mRNA vaccines kind of rev up your immune system, it actually allows your body to kind of attack the cancer cells if you had any, or if you were it's actually having like really interesting implications for cancer research that they're just now discovering. So yeah, that it's a really, really cool thing. And on top of that, long COVID exists. So long COVID is a neurodegenerative disorder that we're discovering that has basically a SARS-CoV-2 latent infection where you develop like chronic fatigue, vertigo, loss of hearing, taste, lots of different stuff. And the idea is to use like long COVID is somewhat stymied by the vaccine. It doesn't make you immune, but it does help. It does help a lot. Yeah, Pajama, shots don't feel good for anyone, right? They kind of suck, and it is true. But you know what? Like, it's something that we have to do. It's a burden that we have to do in order to look out for one another. And we have to, it's something that a burden we have to bear because we get to have vaccines. That's the thing, is that we are very lucky to be able to have vaccines because we don't have to have the risk of having an infection of polio or measles or anything like that that could do a lot of harm. Exactly. We're very privileged. Exactly. Hi, Messa. Thank you so much. Thank you for the heart me's and everything. Thank you. Exactly, K-Bug. I talk to my kids about how vaccines give us superpowers, like Superman and stuff. So we do like the Superman, like that kind of stuff. You know, I think it's a cool way of understanding how the importance of vaccines. Oh, hi, MB. Yeah. It was just last night because of the long It was just because of the long game, lane game and stuff. I've heard that there is a possible vaccination with the link to Alzheimer's. No, I don't think so. Not that I've heard, Christy. Laura, thank you. You might be thinking about autism, Christy, and there is no link with autism and vaccines. Laura, you are awesome. You got your flu vax 9:57 in 3, 2, 1. Yes. You are awesome. Thank you so much. Thank you so much, Laura. You are awesome. We love people who get vaccinated here. We celebrate them every shot, every single time. Very important. Megan, we learned today that plants' cell walls have a secret ability. So plants have a secret language that scientists are now only starting to decipher. Signals from the plant cell wall help to orchestrate growth, reproduction, and immune function. And we learned how they are important in signaling to the rest of the cell what's going on. They say, hey, we're damaged. Hey, we have stuff going on. They do scream. Absolutely. We got our COVID vaccine. Butter. Let's go. Butter. Hi, Trayton. Terryton, how's it going? Butter, awesome. Let's give it up for Butter, guys. In 3, 2, 1. Yes, Laura, it is incredibly healthcare workers. You guys are on the front lines. Thank you guys for what you do. I love and appreciate our healthcare workers here. We're really into public health because that is where science meets the public, right, guys? That is how we can actually see how our lives can be improved by science. Cigarettes. Okay, I don't understand that. I know, MB, isn't it crazy? It's been so awesome. It's been so cool. People got, oh, Britt, you're awesome. Got your flu vaccine. Let's go. 9:59. Guys, Britt for Congress. So awesome. 3, 2, 1. Heather, I didn't. I heard something about like there's been research going on to it, but I don't know anything. Yeah, Barbara, but we also have vaccines, and maybe God made us vaccines as well. So use that. Envy, that's so funny. Yeah, love to see, guys. We'll see. We're cruising, we're having fun. So I think like having something that's organic and all good, and I don't want to pull on like our contacts or anything, and yeah, I just want to do us and have that happen. I work with patients with neurodegenerative diseases, advanced stages, Alzheimer's. Vaccines would be, oh yeah, maladaptive. Yeah, they would be. Who are you, Barbara? Who are you, Barbara Ann? Let's see. Oh, are you a healer? Are you one of those healers, Barbara Ann? Do you have like stuff? Are you selling stuff in your TikTok shop? Is that what's going on? Did well, Megan. Yeah. So they have yeah, they reached out to my references. So that's cool. Hey, Linda, how are you? Is the flu vaccine only available in America? I don't think so, Angel. I hope not. Yeah, yeah. Thank you. Thank you. Oh man. Yeah. How how would being diseased make you indestructible? Like, wouldn't that? I think as a vaccinated person, I feel more indestructible than immune compromised. You know? Yeah, there, Barbara. That doesn't. That's not always how it works, man. That's the thing, is that a lot of people don't choose to have, or don't choose to have a healthy immune system, or they are not born that way. So what we have to do as healthy people is order to look out after everyone, and we have to get vaccinated to help ourselves and the people around us. Because, like it or not, when, you know, 200, 300 years ago, before medical science, the life expectancy was 30 years old, and 50% of kids died. So that's the reality. Vaccines and antibiotics and modern medicine helped us save those kids, and that's it. So that's what you should actually be thinking about. You have 5 kids. Imagine if you had to, if you lost 3 of them. Which one would that be okay to lose? Ever think about that? How close to immortality do you think that we are? Decades? I don't know. I mean, the singularity with Ray Kurzweil and stuff, I guess maybe the closest we are to that, and that's like decades maybe. It's not fear mongering, Barbara. That's history. That's actually history. That's what we literally happened with humans. So she's probably one of those like 6,000-year-old Earth people. So if her profile is literally dozens of dozens of Bible quotes. So I'm gonna assume she's a young Earth creationist and 6,000-year-old person, and she thinks that like Moses was 1,000 years old or something. And yeah, so is there? I heard that there was a trial to combat Alzheimer's. Yeah, Christy, you should try to see if your dad qualifies for any type of research group. So a research trial. That's a good one. Yeah. Yeah, Barbara. That's what I'm saying too. I totally agree. No, I'm saying I'm not a flat earther, but I'm assuming that Barbara is. So our young, flat, just completely flat, like come on, you know, it's so funny. Like, you guys, like, it couldn't even just be like a Pringles chip. You know what I mean? Like really completely flat, like really like a flat, like really. There's nothing. There's no waving, like a wave somewhere. You know, it's very weird. It's very weird. Ruffles, yeah, like a Ruffles chip. Like nothing. There's nothing. Like it doesn't look flat. Yeah, Kendrick, you can just like request up, man. All good. I mean, like, just imagine how much money these corporations would sell tickets to the edge of flat Earth. Like they would, like there would be hotels, there would be plane trips, it would be massive profits in order to like make tons of money off of it. Hey, Kendrick, how's it going?
Good. How's it going tonight?
Good, man.
So I had a couple of questions.
Mm-hmm.
I work for a healthcare company, and normally we had a bunch of health advisories that were going around for quite a while, and
Mm-hmm.
I got used to that. I don't work on the healthcare side of the
Okay.
company, so I'm not terribly informed. But I wanted to know, as far as like current day, what would you consider to be like the biggest threat vectors, right? Like the most concerning items that are coming about on the health sphere.
What are the most concerning things in healthcare right now? So
Yeah, besides, yeah, not on the policy side, more on the like emerging threats. Like if there's anything, you know, becoming more emergent, or infectious rates are increasing, something along those lines that you've heard of.
I mean, yeah. I mean, I think Linda's right. The measles, the measles outbreaks that are happening all across the country right now is pretty wild. I
Yeah.
mean, there's 800 cases in Texas, which is incredibly alarming. And it's like it's 100 more than when they said that they called it over, and they said that there hasn't been any new cases, and then there's been 50 or something since. So it's pretty wild. That's really bad. I mean, everyone's healthcare premiums going up soon. That's a really bad thing. That's going to cause a lot of problems, and that's not going to help these type of infectious diseases. Hi, Ducre.
100%.
But yeah, I mean, I'm not a physician, but that is what I would think off the top of my head.
I appreciate that. Yeah, figured I'd throw it out there just because, like, vaccinations are 100% something I'm behind. So,
Nice.
no qualms there. The second question that I had was regarding resources. Struggle with a couple of people in my life who are very anti-vax, anti-research, anti-medicine, quite a number of them, and I'm doing my absolute best to provide them with resources and sources to, read through the studies as they can just do on their own time.
Yeah.
I
wouldn't do that approach. I mean, you can't. I mean, Dawkins has a quote like, "You can't reason someone out of a position they can't reason themselves into." So, like, the studies and stuff aren't going to be. That was already there, and it's important to know. But, obviously, it is important, but I think genuinely, like, asking questions is actually a really good way of going about this. So kind of like asking questions why they believe the things that they believe, and asking. I mean, it's called the list, which is like the conspiracy, the scientific consensuses that we have, that anti-vaxxers don't believe. So, so it's like germ theory. A lot of anti-vaxxers don't believe in germ theory. Yeah, it's Socratic question. Yeah, it's Socratic method. Yeah. A lot of them don't believe in germ theory. So, like, they don't believe that vaccines are necessary because viruses don't cause disease. So therefore, the only bad thing that could come from vaccines is vaccine side effects. So, why would I have a vaccine? They don't germ theory. They don't think that the immune system is real. Some of them, which is kind of wild. Obviously, they don't think that the SARS-CoV-2 was a natural zoonotic spillover event. They think that it came from the lab. Moon landing is fake. Space is fake. Flat Earth, 6,000-year-old Earth. Gravity is fake. Evolution is fake. Dinosaurs are fake. Climate change isn't happening, or not caused by humans. And like all of these scientific consensus questions, they're the real interesting part, and where you can really start understanding is what the goal of these questions is actually to find which one do they agree with. You need to find a scientific consensus question that they agree with, because then the question is like, okay, so then why do you agree with the age of the Earth, and you don't agree with anything else? What is about, like, the age of the Earth that you think is a good consensus thing, and they'll be like, oh, I like physics, or I like, I don't know. One that usually is a good one is like dinosaurs. They'll, as a kid, they will think that dinosaurs were real because they loved dinosaurs as a kid, that kind of thing. And then it's like, okay, so now 9/11 isn't a scientific consensus question. That's just a conspiracy. So you're not understanding the list. So, but dinosaurs is one, right? Then it's like, okay, well, this person like needs to be like personally invested. This person really needs to like see things for themselves or something. They need to like feel it and have a personal connection. So then it would be like, okay, so then you could start talking about some of the broader, anti-vaccine, talking points and stories about the viruses. So instead of studies about vaccines and vaccine side effects, what we should be talking about are the dangers of the viruses. We focus in on vaccine side effects, and not the things that vaccines are preventing us from. The 30 different diseases that vaccines are stymieing. What was the world like when smallpox was around, when measles was running rampant, when polio was happening? For real, like before antibiotics, before modern medicine, 50% of children died. 50% of children died. Like if you had, I have 4 kids right now, like 2 of them wouldn't have made it, just because the kids are most susceptible. They don't have a robust immune system yet. They're the most susceptible to these diseases, and they're constantly going rampant. The outbreaks are happening all the time, and so they die at higher rates. So stuff like that. Those are the stories that the anecdotes that I would probably lead with.
I think that what's so tough is that I've got, unfortunately, people in my life who are so divided on the different kind of thought camps that they will divide themselves into, where I do have skeptics that are saying, the vaccines cause X and Y, etc. But unfortunately, on one side, they are saying, oh, vaccines cause autism. Horrible. My brother is autistic, and he is a functional human being who I love, who is a perfectly normal person as far as I'm aware. So like, he survived. Vaccines are a very fantastic tool, which we as humanity developed, and like we lived through a bunch of horrible things.
Yeah.
And they were functional. And are you telling me that like the alternative is better than the symptom? I don't think so, particularly. But what's the greater evil? And that discussion never leads anywhere. Obviously, it's a dead end topic of like an ethical dilemma when brought with that. I get that, but it's tough, because then on the same side of the family, it's the same thing. It's like, what are you gonna say? It's better to have autism, or that's the argument they suddenly have to defend. It's tough when they don't want to look at the science. So the pulling of the thread is the painful bit. To figure out where that's coming from, and that it requires two. So I don't know.
No, I agree.
I'm not expecting for you to have the answers.
I would just ask questions, man. I think that is the big. A lot of them, like, where do they come from? Why did you start? How did you start down this journey? What was the thing that opened it up to you? And a lot of it is like a YouTube video,
Sure.
vaccine documentary, that kind of stuff. And it's like, that's the sad part. That's the danger of these algorithms, feeding these conspiracies to people, because conspiracies are an easy way to understand a complex topic. And once you're hooked on one conspiracy, you're gonna get hooked on another one, and that's why the list exists, and that's what it happens. And you know, it takes people like you, like, don't give up on these people, was what I would say. You know, I also think that it's not your entire burden for your mental health, like, to deal with this, but don't write these people off. You know, just keep trying to engage in them. You know, don't give up on them, because, you know, sometimes you might be one of the only people that's actually grounding them and challenging them, because people's AI social media feeds, that is the reflection of what the world is, because their AI media feeds are they probably see 100 stories a day that they scroll by with all these vaccine side effects, right? They probably see all these, you know, perfectly healthy kid now dying from a vaccine, you know, like crazy stuff like that.
Right.
So their own eyes, they're seeing that and they're thinking, wow, another one. And wow, what incredible. And then in their mind, they're thinking, like, how could you not understand that these things are happening? I see these happen all the time. You know, so people, you know, come into the chat and they're like, what are you talking about? Of course they do. And it's like, no, dude, they don't. And I also, you know, ask for sources. And then the big thing, like, don't, like, read it with them, like, bring it up. You know, they'll have a paper or something a lot of times, and I'll bring it up live, and it's very scary, you know, because I'm thinking,
Oh, they
like,
get
oh my god,
oh man,
oh
they
man,
get
what if
so
this is good?
defensive.
You know, what if this is a good one and I don't know how to debunk it or something, you know? And then I pull it up, and it's like, sometimes the link itself, man, like, this one guy had a LinkedIn link, which is obviously already weird for, like, an anti-vax publication. They linked the LinkedIn, and it was a post, and then that thing posted to some other blog, and basically it was like the blog of something. But anyway, that website link, in bright red letters, was like, this is not what that is. This is not right, because they had obviously gotten back to the author that their study was being used incorrectly for anti-vax talking points, and the author was so perturbed about it, they changed the entire website over to say, this is not what it is. Stop using this. so
Love that.
don't
Hey,
be
some
afraid.
academic accountability. That's
Exactly.
good.
Yeah. Don't be afraid of actually opening up their stuff. And a lot of times is that they'll be cherry picking data. They'll be cherry picking, like, I mean, in every publication, the second paragraph or third paragraph into the discussion is like limitations of this study. And they'll say, like, you know, the limitations of this study was, you know, it could have been a bigger group, or we didn't have, like, all the corroborating evidence in order to show everything that we wanted to show. And then they'll clip that and be like, see, they don't have information to say what they want to say. Even the authors themselves are saying that they don't have what they need to say. And it's like,
Yeah.
well, that's called, in science, it's called misattribution. So you're quoting it out of context. But, you know, but the title will agree with you. It's with science. The graphs will agree with science, but then the anti-vaxxers pick this one sentence and they're like, that's when the scientist actually was telling the truth.
Right.
Like,
they find that I've been locked into many a late night kitchen discussion of of that exact moment of,
Yeah.
well, no, this is where the info is. It's the bit that's omitted from the study. It's like,
Yeah.
all right, well, it's not the bit that's locked in documentation forever. So what do we do about that?
Yeah.
So
Yeah, exactly.
anywho, hey, I appreciate your time.
Oh, thanks,
Thank
Matt.
you for
I
entertaining
appreciate
my
keep up the good
ramblings.
fight, okay? I appreciate you.
Have a good night.
All right, guys. I used to have all those political discussions. Oh, thank you, Linda. I used to have all those discussions with my parents and my uncle and my grandparents. That was, man, dude, we got into the Thanksgivings and the Christmases around the Iraq invasion time. Oh my gosh, that was wild. I'm watching your live now, but unsure of your mission. Can you give us a brief summary? Okay, cool. Hi, Mrs. Moore. I am a PhD in microbiology. I'm a scientist. I've been doing molecular biology for 16 years, genetics, microbiology, fermentation, host strain engineering. I basically genetically modify yeast in order to make proteins and stuff. That's what my day job is. And I'm a science communicator. So I try to answer questions about science that people have, and they come in and we have it's basically like ask a scientist. People can ask me whatever it is. And we are currently mobilizing. So one thing that we do in order to celebrate vaccinations, which is, vaccines are a way that science is improving our life and through public health. So that's what our vaccines are. So our vaccines is the counter of how many vaccines just our community has gotten. This is in like 6 weeks. We have gotten over 950 vaccines. We're going to hit 1,000 really soon here. And then recently we have started a political movement in order to help stop these 423 anti-science bills that are trying to be passed in all the state legislators. So right now we are targeting Michigan. So Michigan, if you go to action.drgregshow.com, this is where you'll see a background of the bill that we're trying to defeat, an explainer of it, the swing voters that we are actually targeting, the swing voters in the state legislative body, and then the call and the email template. And every time someone makes a call or makes a email, we track the actions. So this is 126. This is only 3 days, guys. In 3 days, we've made 126 phone calls or emails. That is just unbelievable. I'm so proud. It's so cool. I just absolutely incredible. I'm blown away. Nightflyer, I did the CSO interview on Thursday, and my references are being asked for right now. So that's usually a pretty good sign. So that happened yesterday, and then they sent them today. So hopefully the job offer by the end of the week, hopefully. I'm like 90% sure we got it. But yeah, the Michigan bill that we are trying to stop right now is bad because it's trying to ban all types of gene therapy. So gene therapy is a way that you can have a personalized anti-cancer drug that targets your specific mutations and helps extend and helps the lives of people with cancers. And they are trying to ban that just because it's mRNA technology. mRNA technology is the current technology used for COVID vaccines, also linked with anti-cancer stuff, which is like a crazy new study that just came out this week. Really cool. Basically, the mRNA and the lipid nanoparticles prime the immune system, gives it into like an overdrive, trying to help protect the body, and it makes people live longer with cancers that they have. So it looks like there might be some anti-cancer impacts in those mRNA vaccines. And it's a bad bill. It's a bad bill. It's going to harm people, and it's going to potentially lose the license. You're going to lose the license for a physician by administering a vaccine. So it is awful. Kendra, which study for which one? Oh, dude, I just realized your name, dude. That's sick. Kendrip Lama. That is cool. Kendrip Lama. That is amazing. It is blank, but it's what it should be is MADA, Make America Diseased Again, because they are pro-virus. They are pro-viral spread. Oh, Ducray, genius. Yes. I don't think that many people go to my link tree, but yeah, that is a good idea. I know, Night Flyer. Isn't that so cool? It's so cool. Oh, because of the COVID. Yeah, the COVID mRNA vaccine anti-cancer. Thank you for asking. Here you go. Here it is. Yeah. Thanks for asking. Thanks, Mace. How dare you, Ducray? Just kidding. Oh yeah, Blink. I'm frustrated too. Thank you for carrying. I appreciate you carrying. It's gonna be better. It's gonna be better. This is, guys. This is a political science. This is an overreach. This is a classic overreach scenario. In 2006, I remember people were, or 2004 rather, talking about the death of the Democratic Party and that there was no way that there was any going to be a Democrat ever again. That George W. Bush and the Republicans were going to be solidifying their political power and nothing else could stop them. Back in my day, that's what they said. And they had no idea in 4 years, you're going to have a charismatic young leader showing up that would change politics forever. There's a lot of Ducray. That was the popular mainstream like talking head on like CNN and NBC and stuff. Yeah, they were just like, because there was nobody, like Kerry was seen as really uncharismatic, and they didn't have anyone that was kind of like up and running, coming like in as a potential. So it was kind of like, yeah, it was yeah. Yeah, exactly. Pierre, I agree. Yeah, it's gonna swing back. It's gonna swing back for sure. We just have to survive. And this is why, guys, this is why you have things like the systemic attacks by Trump in order to win those institutionalized power, right? With the 5 seats from Texas. So they're re-gerrymandering Texas so that they can get 5 more congressional seats, because they want to solidify their institutional power. That is what the goal is. So, yeah, I mean, yeah. This is why we passed a constitutional amendment to ban people guilty of insurrection from becoming the president. By the way, this is what, like, we were trying, that was actually, we thought of this. So this was something that was thought of, passed, and we've done this. They knew this was going to happen. People that are guilty of insurrection don't really play by the rules necessarily. They don't care about laws. I know it sounds crazy. People trying to overthrow the government don't really care about it, but it's true. It's just the Supreme Court. Oh, Roberts. Do they have the right to redistrict like that? So normally it's done like every 10 years. So normally, so they're doing it early. They do have the right, the constitutional right, in order to do it. But and to gerrymander is legal as well. But they're doing it early specifically because Trump wants him to. So that is the weird thing about it. Exactly, Laura. There's a reason. That's what they say about safety legislation too. Safety legislation is written in blood. Like, people died in order to have that safety legislation in, and people are so flippant about it. But it's like that. It's actually important enough that people like actually got injured from it, and that's why it exists. Oh, no, really, Night Flyer. I'm sorry about. Have you heard of alpha particle therapy for cancer? I haven't, Harry. Sorry. Yeah, exactly, Kathleen. And when does anyone in this administration care if they have the right? Exactly. Oh, it's so true. Sorry for changing the product. Does your product enter the nucleus? Does your product, which does my product, but I don't have a product. Is my hair product? Does my single walled carbon nanotubes that I made that I am somewhat of an inventor myself. Any new thing that I'm excited about? Any new trials? No, not really, Christy. I'm not on like human trials. Like David R. Liu is probably like this is my favorite researcher. He's constantly doing awesome things in regards to human gene editing. So that's like something that I'm really, really interested about. Anything that he has. He is teasing something that he doesn't need individualized like medicine now in order to do what he's doing. So that's kind of like a huge tease in the molecular biology world. Like, what is David R. Liu, like the greatest molecular biologist in the field currently? What is he actually cooking up? And nobody knows. So that is probably the most exciting thing that I'm excited for. How will he survive medically for 3 years with all the cuts in funding for research and studies? It's really hard, Jen. We don't know. I mean, that's a really good question. States hopefully like the states can give some respite, but yeah, most of the funding, $80 billion a year comes from the federal government, so it's very bad. It could impact us for 5, 10, 20, 40 years, 45 years. Like the solar voltaic industry was impacted for 45 years after Reagan dismantled it. The government is here to help. Trust us. Yeah, I mean, the whole point is that we're not asking for trust. We're asking for qualified studies with empirical data. That we're not asking to trust anyone. We want to see the data, and that's the data is behind vaccines. So it's actually the RFK that's just saying, just trust us, bro. He literally said, we're doing the studies in order to help prove what we're talking about. He even admitted that there were no studies to corroborate what he was talking about, but they're having to fabricate some studies in order to try to say that he knows what he's talking about. Kind of embarrassing for your dude, for your guy. No, Pierre. I did my PhD with single walled carbon nanotubes. That's what I did my PhD with. States will have to profit the scientists, along with the space research. Yeah, Laura. I mean, what's going to happen, guys? Probably there's a good chance that basically the hub for science and technology just isn't in U.S. academia anymore. That's probably what most likely happens. Companies aren't being formed here from startups. Countries start paying in mass for scientists to move there, that kind of stuff. Yeah, it's just not going to be through science it's not going to be through the United States anymore. That's the most likely thing. It's sad. It's very sad. Exactly, Kathleen. Yeah. We won't be at the forefront. Yeah, I think that's cool. I don't know. Yeah, exactly. Do crates. You can't just like restart up, all that stuff. Hi, Voice and Velvet. Well, thank you, Voice Develop. Do facts and figure and data equal science? Well, Eben, you have to have, not necessarily. It has to be reproducible. It has to be published. It has to be peer reviewed. You can have, statistics can be very misleading. So, hola. Bien, bien, bien. Yeah, reproducibility. Mm-hmm. All right, guys. Well, we are currently politically organizing for Michigan right now. If you haven't done your actions today, that'd be awesome if you did them. Emails, phone calls, helps us make an impact on these bills. And I love that suggestion, getting a letter writing campaign. That's what I'm gonna do. I'm going to start emailing these businesses, see if we can actually get them companies on board. You mentioned a particular molecular biologist. Can you recommend more research for us? David R. Liu. Yeah, David R. Liu is honestly, that's the guy. David R. Liu has an X account. He's incredible. He's one of the only people that are doing science Twitter. Check him out. Like he is the best, one of the best scientists in the world, and a lot of people don't even know about him. That would check him out. David R. Liu. He's incredible. Will the mindset of American exceptionalism change when the U.S. is not the center of academia? Laura, that's a really good question. There's always been a conflation with American exceptionalism with freedom and liberty and ignorance. Anti-intellectualism has been around in the United States for a really long time, and they confuse patriotism with selfishness. So they think that freedom and liberty is just for myself. It's just you, and that's not how we are. That it's the United States of America, right? The united, and means that there's more than one, and also means that freedom and liberty is granted by like we the people, us all coming together, looking at us as a public, as one. And there's also been an incredible history of vaccinations in the country. George Washington required vaccinations in some of his fighters. It's LIU. Oh, I don't know the U.S. Okay, thank you. Yeah, knowledge is power, but knowledge through science is the most powerful. So, yeah, exactly, Laura. We are global citizens. I totally agree. I don't. There is no like extreme left in the United States. We definitely do not have. Do create? You can. I think, or you can leave that part out. It is what you want. Whatever you want. All right, guys. Shout outs real quick. Oh, dang. Eben, that is one part of it. Yeah, Eben. So science is data, numbers, facts, figures, but you have to be able to peer review those facts and figures. You have to publish it. You have to get it seen and tested by other scientists and reproducibly like looked at it. It's not just having a figure or something. That is not necessarily just science. Yeah, no, I'm not just a timeshare salesman. I'm a time traveling timeshare salesman. So yeah, yeah. So it's a big part of it, because like most people just sell timeshares, but they don't time travel. I'm really selling sharing the travel of time. That's my thing. Yeah. So it's something I'm working on. So it's something I'm doing, with lots of facts and figures and data and science. It's just, it's incredible, Evan. Thank you. That's a very well. Wow. Thank you. Thank you, Evan. What? Why is it like when people say knowledge is power, they're just saying read the Bible? Like every time. It's just like, it's so funny. Knowledge is power. Knowledge from the Bible is power. That's like it. It's like, it's always that. It's always that. It's like, okay, how about knowledge from science? No. How about power that's given to people so that they can survive outside of the time that, we had vaccines and no vaccines and child mortality was 50%? And no. That's okay. All right. You got me. Oh, okay. Nice. Nice, Christy. Nice. Thank you guys so much for all the fans, super fans. Thank you, Helen. Thank you. I appreciate you. Thank you, Kathleen. Thank you so much. Thank you, Helen. Thank you, Voice and Velvet. I'm sorry. Night Flyer, Bailey, Ducray, Share. Thank you guys so much. Thank you so much to all the likes. 1,000 or 44,000 like Ado. All right. Diane, Bailey, Share. Megs needs the beach. Get this person to the beach. Noble Sharon. Patreons are Mrs. Dr. G, Ado, Call Me Nest, Getting Involved, action.drgregshow.com. And you are awesome. Ducray, Legend, Ducray is so awesome, guys. Really couldn't do it without her. She's so nice. Don't give enough shout outs to Ducray. Guys, let's give it up for Ducray. 127. 127. In 3, 2, 1. Yes, Ducray. AX. Actions. We're trying to figure out what we're doing for. We do V for vaccines. AX for actions. I love it. I love it. Thank you guys so much. I want to get like an up fist. We're gonna drums. Thank you, KC. You're awesome. It's awesome because you're here. It's about you guys. Honestly, you guys are the community. It's not me. And I appreciate you so much. And I appreciate you fighting back with me and getting this thing going. Together, we can stop these bills. We're not going to stop all of them, but we're going to stop some of them, and we're going to celebrate that. They're not going to win all these battles. They're not. So from New Hampshire to Massachusetts to Michigan, we will fight back. We will. You know it. And we'll start it again tomorrow. Another state, another Maha bill taken down. We will target. It's a takedown. It's a takedown, down. You know how it is. We're some demon hunters. That's how we do this. Are you guys ready? Are you ready for tomorrow? Let's do it. Have a good day. Have a good night. Be nice to someone. Be kind to someone. And let's do it tomorrow. Boom. See ya. Have a good one. Bye. Get your actions. Call. Email. You can do it. actions.drgregshow.com. See ya. Peace. All right. That's it. YouTube. Thank you. Thank you so much. Thank you for watching YouTube. I appreciate you. I'm always here watching YouTube chat. I'm always answering questions if you guys are ever here. I appreciate